All right, so let's jump into our first panel. Can we? There we go. There they all are. It is called Implications of Policy Changes on Higher Education and the Health Professions. As we all know, we're going through some turbulent times, and it's important that we remain up to date. I think it was clear yesterday from our discussions with Vicki, and then just as we went throughout the day, that maybe iHeart needs to offer more opportunities for discussion amongst our regions about best practices and how we are handling these times. Today, we're going to get some voices from DC, though, some people who are very involved in what's going on and can help maybe guide our discussions or how we move forward for iHeart. So our first panelist today is Moriah K. O'Brien, Vice President of Congressional and Federal Relations for the American Indian Higher Education Consortium, or AIHEC, one of our partners. Next, I'm sorry, not one of our partners. Yes, one of our partners. I always get them confused with another organization that we have locally. Apologize. We also have Danielle Turnipseed, the Chief Public Policy Officer of the Association of American Medical Colleges. And then finally, Lacey Wynn, Director of Public Health Policy and Programs from the National Indian Health Board. Each of them is going to give a short talk, and then we'll have a presentation, or we'll have opportunities to ask them some questions from their talks immediately afterwards. So we're going to start the list. The way that I have this on my list is Moriah O'Brien will start us out. I hope that's the same as what you all understand. So go ahead, Moriah. And thank you for being here.
Wonderful. Thank you so very much. It's an honor and a pleasure to be addressing everyone today. I'd like to give a shout out to my colleagues, Izzy and Reno. They're doing amazing work. I'm really, really delighted. A big part of what we do is connecting, supporting, and also I get to be part of the advocacy efforts on the Hill. Sometimes I feel like an octopus. I'm constantly grabbing information and moving it around and getting it to the right people. So a little bit today, I kind of wanted to give a little bit of a lay of the land about what's happening at the national stage and kind of how that then ends up impacting folks on the ground. But things can move really quickly, so it's helpful to kind of have a landscape level understanding. Since we've seen this new administration come in, we've seen executive orders, we've seen lawsuits going back against those executive orders, we've seen the creation of the U.S. DOJ service, which is going in and making changes at agencies, and more lawsuits about that. We've seen an OMB, an Office of Management and Budget Director, who believes that the federal government should be able to pull back and just not spend money that has already been appropriated by Congress. And we've seen a president who has a very strong arm when it comes to dealing with members of Congress of his own party to bend them to his will. So where does that put us? What we have right now is not only have there been lawsuits, none of which AIHEC is a party to, but there's many different organizations that are filing lawsuits. There's also a concerted effort to do this kind of quiet background outreach because right now, Democrats in Congress don't really have a lot of cards to play. So we have to look for our Republican allies in Congress, and they're not comfortable getting out in front and advocating for things or following up with the administration, but many times they can go and have quiet private conversations or phone calls that are not on the record. They just don't want to get out in front, but we've seen slowly the fruits of their efforts trying to mitigate some of these extreme actions that are coming out of the administration. So one thing that has been really helpful for us is AIHEC recently had our legislative summit, and our legislative summits are pretty exciting. We have the presidents and staff and students from all of our member TCUs fly into Washington, D.C., get together, talk about relevant issues, and then go and meet with all of their individual congressional delegations. Because TCUs, tribal colleges and universities, are doing absolutely amazing work, providing workforce development, especially in health professions, contributing to their local economies, and educating tomorrow's leaders. So oftentimes TCUs can come in and visit with their congressional delegation and really have a good conversation about all of the amazing things that they're doing, and bank on those really excellent relationships and that important work, how tribal colleges and universities contribute to their communities and to that congressional district. Um, so we have worked very hard to maintain bipartisan relationships, because, you know, elections happen every 2 years for Congress and every 4 years for the president. It's constantly, the balance of power is constantly changing in Washington, D.C., and we cannot afford to have one party or the other being our supporters. We have to be friends with everybody and work with everybody. Um, so we've really seen that balanced, nuanced, strategic approach start to pay off. We have seen now that the president has, rather than giving the US Doge service free reign to just go in and change things, that the president has asserted that secretaries of agencies have ultimately have the discretion with regard to these changes, to make these staffing and budgetary changes. What we're also seeing, oh, pardon me, I live close to the Capitol, so there are sirens all the time. So if you heard some sirens in the background, it's happens every day here in DC. Um, what we're seeing is um, an effective strategy of reaching out to individual secretaries with tribal specific priorities. And the message has clearly been the amazing work that TCUs are doing in their communities. And also, this is very, very, very important. This is foundational, that tribal nations, as sovereign nations, have a nation to nation relationship with the federal government that is based on treaties that were signed between these two nations. Each tribal nation has this individual trust and treaty relationship with the federal government, and that programs, services, support, funding, all of that, some of that is explicitly spelled out in treaties, others of that is more general and has been affirmed by Supreme Court cases and federal law, that there is a trust and treaty obligation to tribal nations and by extension tribal citizens. So as we negotiate with federal agencies and with congressional offices, we are extremely clear. These program services and functions and support for tribal nations are part of the nation to nation relationship and the federal trust and treaty obligation. These are not DEI. That is a completely separate conversation. It's an important conversation to have, but it's completely separate, and it has nothing to do with the obligations that the federal government has willingly entered into with tribal nations. And tribal nations, when by extension, they charter as an expression of sovereignty tribal colleges and universities. Um, so that's really been the thrust of our messaging, the nation to nation relationship and the federal trust and treaty obligation, and also the incredible work that TCUs are doing. Um, what we're seeing from this administration is a pushback generally against institutions of higher education. However, we are making the case that TCUs are really embedded in a part of their communities, are engines of economic development, and are engines of workforce development. That they're not part of this kind of broader conversation that the administration is trying to have in these other concerns that they're raising. So that's a little bit kind of how we're positioning TCUs. I also want to talk a little bit about partnerships. So AIHEC is part of a partnership with a number of other national Native organizations. So we work with National Indian Health Board, with the National Congress of American Indians, with the United South and Eastern Tribes, with the National Council of Urban Indian Health. We have this national coalition group of tribal organizations working to support each other, have consistent messaging together, and have shared letters to the administration talking about how we can work and engage together and make progress for Indian country, and how the federal government can better uphold and endeavor to uphold its trust and treaty obligations to tribal nations. So that's a little bit of the lay of the land. I want to turn it back over to my other panelists to give some updates, and I'm looking forward to our panel discussion and questions. Thank you.
Thank you, Moriah. Next, we have Lacey Wynn, Director of Public Health Policy and Programs at the National Indian Health Board. Go ahead, Lacey. Are you here?
In here, I have slides because I would be in big trouble if I got this stuff wrong. So let me see. Do you see? What do you guys see?
They're
Do you see
coming
my
up.
slides?
There you
Yeah.
go.
Awesome. Well, welcome everybody. Happy afternoon on a Thursday. So I'm Lacey Wind. I work at the National Indian Health Board. So if you don't know, some people don't know what we do. If you don't know what we do, we serve all 574 tribes. We make sure that they have meaningful consultations, government to government consultations. And we are a unified voice for the tribes in advocation. So today I'm going to talk a little bit about, I guess I could do this. It's okay. We'll have my notes if you guys don't mind. I don't know why. Oh, here we go. Sorry. We'll do this right. Okay. So today I'm going to kind of talk about what is happening currently at the government, and then we can dive into a little bit how that affects workforce and the Indian Health Service. So do you guys see the federal workforce? I have 3 screens. Do you see that?
Yes.
Okay, we are on the right screen then. So what's happening in the federal workforce? So the president memorandum issue of the hiring freeze is still ongoing. The return to office is still ongoing. I actually was just talking to one of our IHS friends that they had their first day in office yesterday. So everybody's going back to the office. The fork in the road, about 2.5% of IHS staff have taken that, which is about 375 staff. So the executive order, so DOGE, the Workforce Optimization Initiative. So I'm going to tell you what is in that, the implications, and then, so don't get worried, I'm going to talk a little bit about how that affects IHS. So what is in that that is important for us is that there's exceptions for immigration enforcement, public safety, and statutory services and functions. So they cannot participate. They're an exception to the DOGE buyout plan. So everybody needs a reduction in workforce plan, which is called a RIF. And then we also have a 4-to-1 hiring replacement plan. So that in implementation of that, there was the probationary that everybody heard, the probationary employee layoff that happened from February 13th to the 17th. And then we had the buyout. So the early retirement and then the voluntary separation buyout, right? Where you're just saying either I want early retirement or I'm just going to leave my job. And so those are the VISP and the VERA. And then everybody needed to have a RIF plan submitted by March 30th. So when we're talking about the RIF plan with IHS, it's a little unclear because we already have a huge percentage vacancy rate. So what that means and what that RIF plan looks like could actually not affect the already huge vacancy rate. So for the federal workforce in IHS, so the staffing is already about, I have a graph for you guys just so that you can see, but the staffing is already at a 30% vacancy rate, which includes 36% of physicians and 44% vacancy rate for behavioral health providers. The exception for IHS so far for the firing freeze is the 600 level providers. And I put that in there because I'm always like, what does that mean? So that's your doctors, your nurses. This also included behavioral health providers such as technician workers and psychiatrists. So the fork in the road, the separation, and the early retirement, those exceptions to the offer are the service unit level staff, and then again, the 600 level staff, also mental health counselors, psychologists, social workers, other specific staff. So the impacts of this on IHS is that about 950 IHS probationary staff were to be terminated. In about an hour or two right before that was to happen, it was rescinded. So I think there's a couple of languages out there. Some people are using the word rescinded, but the secretary is actually saying it is on hold. So what that means is still pretty unclear, or what that looks like going forward. Also, obviously, the impact of it is that staff morale is scared, chaos, and so the morale is down. So I did put this just for your guys' information. The vacancy rates, so this was previous to the administration. So this was in February 2024, and talking about, that RIF plan, what that would look like, might not be affected because we already have a vacancy rate of 30%, physicians vacancy rate of 36%. So there was already a huge vacancy rate, right? So what that RIF plan looks like, it's unclear, but I'm assuming, right? I'm going to go out this, but don't tell anybody that this is what Lacey said. I'm assuming that RIF plan probably won't affect much of this because we already have a huge vacancy rate. So Congress and budget. So the continuing resolution is running in full until September 30th. So what changes in IHS, that means that advanced appropriations for 2026 are there, which means that, the Congress has said, yes, we commit that we are going to pay that, which is a flat fund. And there was a small increase in staff packages in newly opened facilities. The problem is that really actually looks like a cut in the purchasing power of IHS, right? We think about it remained the same from last year. We got the flat rate, and then you have increase of inflation, medical costs, workforce can't compete with other providers or other facilities for providers. It actually looks like it actually comes out to be a cut. And then there's a 5.5 cut in sanitation facilities and healthcare facility construction. In Congress, being driven by reconciliation so that it's dominant action throughout the rest of the year, which means that the Senate can have a majority of vote. But I thought I'd put good news in here, right? Good news is that the Senate Indian Affairs Committee did pass out of committee last week the IHS Workforce Parity Act that provides part-time staff to participate in loan and scholarship programs, and then the Truth and Healing Commission on Indian Boarding School Policy Act, which really dives into the effects of the Indian boarding schools, and then what we need to do after. We also expect the Tribal Tax and Investment Reform Act to be reintroduced in the House, and that includes IHS tax exemption provisions for loan repayment and scholarship programs. So there is good news. Yay. And as of the National Indian Health Board, in really trying to diversify workforce and what we are still advocating for and pursuing really hasn't changed, right? Into our tribal communities, still investing into our tribe, acknowledging what's already in the communities, their strengths and resources, and helping them really build capacity. Still advocating for holistic and cultural initiatives, workforce pipelines, from high school to universities, and then really advocating for that paraprofessional and health providers expansion. Obviously, we want to advocate for loan repayments, but with that tax exemption. And then promoting and supporting Indigenous health programs. So we submitted a letter to support Indigenous School of Medicine, which would be the first Indigenous focused school of medicine and science in the United States. And then investing obviously in cultural safety within the health sectors and our education institutions, so that we're really providing good, effective cultural providers providing healthcare. And lastly, policies that we're still are the same, still supporting full force peer support specialists, the CHAT program, which is all dental health aides, behavioral health aides, community health workers, flexibility for grants for FTEs. So why that's important to you guys is that really promoting whatever community you're getting grants, if we get grants, right, that the communities get to decide what FTEs they want, if they want part-time, full-time, and that's not dictated by the grants. So thinking through how that would help workforce, and then still advocating and supporting for the traditional healing reimbursement through the 1115 demonstration waiver. I think this is really interesting, especially kind of thinking outside the box. So that is where CMS is having a demonstration waiver that we can bill for traditional healing services. So there's 4 states currently, California, Arizona, New Mexico, and Oregon, that are participating in the demonstration, but it's complicated. So obviously they're trying to figure out what that would look like to be able to bill for your traditional healers. And it's another pathway to get into the health services. But it's complicated a lot of times because, excuse me, the grants go to the state. So that means your tribal health services really need to work with your state Medicaid programs. And then obviously if you're a state, there's several different tribes within that state. So it's a good step. It's complicated, and I think that it's another avenue through workforce that we can really think through. So that's what I have for you guys today. And I'll pass it on.
Thanks, Lacey. Our next speaker is again Danielle Turnipseed she was the Chief Public Policy Officer of the AAMC. Thank you, Ms. Turnipseed.
Looks like you are on mute, Danielle.
Unmute. Can you hear me?
Yes.
We can now.
Great. Great. And I'm also going to share some slides. I like that you had that presentation that I was able to follow. So just a few things. And I ask that you give me the thumbs up. Can you hear me? Can you see the slides now?
You're good.
Does that
Everything's
work?
good. Yep.
Great. You know, I'm really glad that the other 2 presenters spoke before me, because it certainly anchors and frames so much of the conversation. Everything that they said is true, and I hope that for the people participating on this session, that you get a context. We know it needs to happen. We know, or we have some insight to things that are going on, but these are really unprecedented situations that we are dealing with. We've dealt with change of administrations before. We've dealt with potential reductions in terms of cuts, but the whole on and the multi-sector approach, I think that the first speaker, went through, and this is pervasive, right? So we all need to be participating in calls like this and figuring out what's going on and what's the impact think that is really important. So let me hop into my presentation today and say at the outset that I'm joined with in this work with colleagues Norma Pole-Hunter as well as Kimberly Bellamy, and thank them for their contributions to this as well. So in case you haven't heard of us, who is the AAMC? Well, our mission is stated there, and we lead and serve the academic medicine community. What do I mean by that? Some of these statistics pull out who's included. So we're the Association of Medical Schools. We have 172 total, mostly in the United States, about 160 in the United States and another 12 in Canada. We also include the teaching hospitals and the health systems, the academic health systems. So that's an additional almost 500 institutions that we add among our membership ranks. We also include about 70 academic societies, and by having those societies and schools and centers as a part of our membership, and also Veterans Affairs medical centers, as a result, look at the breadth and the numerosity of the people that we count among our members. More than 210 full-time faculty, the resident physicians, the moving from medical school into residency. So at any one time, there are about 162,000. And we're certainly proud of the number of medical students in all throughout medical school, first, second, third, fourth year. Okay. I'll make mention also the AAMC administers the MCAT, the medical admissions test, and we're very involved also in the residents will be finding out about their match. So it's a busy time for us. They'll find out where they match to on Friday, and AAMC has a role in that residency application process. So let's look, as we're talking about medical school, let's look at the number of applicants to medical schools, particularly focused on this community here. During 2024 and 2025, this is a big deal. We saw not only a double-digit decrease from the number of applicants to medical school who are American Indian or Alaska Native, it dropped about 15%. And that's huge. That means the number of people who will be attending medical school and becoming future physicians took a significant hit. And if you look at that first line, we saw either steady progress, note that from 2019 to 2020, there was a slight dip, but look at how the number came back in 2021 in terms of the applicant. So this number that we saw from the 2024-25 cycle, 493, that is a low, that is a hit. So the trend of individuals applying, American Indian or Alaska Native students applying to medical school is certainly down. And with that, as you might imagine, the number of actual matriculants to medical school during that same period also decreased. Look at the decrease here, 22%. So that's actually individuals in the seats, right? So we are seeing certainly as represented on this chart, the lowest point since 2017 in terms of the number of American Indian or Alaska Native matriculants to medical school. So, you know, as I listened to the presenter right before me talking about the impact and the need for AIAN physicians, you want to achieve those numbers and that connection to the community that you're looking for if the number of students, the number of matriculants is down. I do note the AAMC has been involved with the community and has a strong commitment related to working on American Indian and Alaska Native representation in medical school. We have not only publications and participate with IHEART, along with other groups, of course, that you know, but we have colleagues, like I mentioned, who are dedicated and are tracking and working on this representation. I want to also share with you all, take a few moments to talk about the AAMC's high-level policy priorities, and I also want to say why. We are focused on 4 areas, top line, one of which is strengthening the academic medicine workforce, and recognize, please, that that workforce certainly, given who we are, includes physicians, but it also includes health professionals, biomedical researchers. You know, being concerned about the workforce allows us to take a whole systems approach and recognizing our pivotal role. We also know that there are other professionals that are needed in this space. So our policies that we're advocating for are about workforce and about, you know, what it's going to take to care for people everywhere. Another one of our priorities relates to strengthening academic health systems and teaching hospitals and the faculty. You know, after medical school, you have to have a place to do the residency and to train. And we recognize the role of that training, not just at our hospitals, but really getting in touch and creating a space for people to come from the community into these systems to receive their care. I've mentioned a few times about how important our medical schools and our medical students are. Well, that requires support and advocacy as well. So this is an area, and considering those slides I had before, let's talk about why the applicants and the matriculants are down and really why it's important and what we can do to address that. And certainly the last priority, top line priority that I want to mention to you all is about supporting the health and scientific research. I think as the other presenter talked about the reductions specifically around Indian Health Service and head counts and positions filled or not, keep in mind that research projects, NIH projects, other projects out of Health and Human Services at local institutions with organizations, many of them have been reduced. So that is another area that we can look at and discuss through the lens of being a policy priority. We've got to make sure that people are actually studying and paying attention to things going on in this community so that we can seek solutions. I don't necessarily subscribe to one size fits all. So if there are particular issues that are being experienced, this is one way, like I mentioned, with support of research and funding that we can seek to address that. I put my QR code up if anyone wants to scan. I won't be offended if I see you taking your phone out and putting it up near the screen, and also my email address as well. And let me just say it has indeed been a pleasure and a privilege to participate with all of you today. Mary, back over to you.
Miigwech, Danielle. Fantastic presentations from all of you. We're looking forward to some lively discussion here. I'll start first with, and we're going to open this up. Izzy, if you can help me with the questions, that would be terrific. It looks like, do we have one question in the chat already? Okay, first question of all, most important, probably not most important, but definitely important to all of us. Can we have copies of your slides, or can we see any of your slides afterwards? Danielle and Lacey. Would that be okay, Danielle?
We'll make them available.
Thank you
Yeah.
very much. All right. The first question that I have is for Moriah, first of all, Moriah, thank you for that comment about needing to work with everybody. I try to remind my students in medical school when I teach them is that we've had slights from both Republicans and Democrats throughout the years and promotion by each party. So I don't think that this is about either party right now. I always remind people that it was Nixon that really enforced our sovereignty with health. So thank you for your comments, Moriah. One of the questions that came up yesterday, and this is actually for both Lacey and Moriah, was how does, should we or should we not be bringing up the issue of sovereignty when it comes to protecting our work, given the potential assault on sovereignty? And I heard you mention it strongly, Lacey. Actually, both of you mentioned it strongly as what the secretary, it sounded like the secretaries are recognizing the importance of that, but aren't we also at risk? And this came up again yesterday. So we'll start with you, Moriah, and then turn to you, Lacey, see if you have anything to add to that.
Sure. And, living is being at risk. Everything we do has risks and costs associated with it. And, every day we step out and there are risks. But I will just say, there are numerous federal laws and Supreme Court decisions reaffirming the nation-to-nation relationship and the federal government's trust and treaty obligations to tribal nations. And right now, that is our strongest argument to make, that, these are obligations. This is in federal law. This is a part of our nation. And because when we try and make other arguments, it can be a difficult conversation. It could be maybe not the right conversation. So I would say that the arguments we have to make flow from the essential condition of tribal sovereignty. And there's strength in that. And there is a concerted effort across the nation from tribal orgs and individual tribal nations to consistently make that argument with this administration and with previous administrations on other matters. And I think there is strength in that, and using that as the foundation, everything else kind of comes from that.
Thanks, Moriah. Lacey, anything to add?
Yeah, I think that the word list, right? I think that is ever changing, and nobody really knows specifically what that is. But I think to echo Moriah, that the only way to make these changes and to stay strong is to have that unified voice. And that unified voice is that we are not DEI, we are a trust responsibility. And so that needs to be repeated over and over by all of us and I think the silver lining is we are definitely learning how to work together and partner together and become a unified voice. And I think that that's the main message that we all want everybody to get out.
Thank you for that, Lacey. I do also want to thank you for highlighting exactly what those executive orders did to the Indian Health Service, because many of us, have been anxious about that. And it wasn't good news, but you did offer some encapsulated well what's actually happening. So miigwech for that. I want to ask or I want to comment as well before we get to, looks like lots of questions are coming in, which is great. I do want to thank you, Danielle, for giving us those excellent statistics on what's happening to our numbers and what, this is all the work that everybody here at IHEART is trying to address. And also want to thank you for recognizing that every single one of the health force is involved in serving our population. And so AAMC's commitment to all is very helpful. I do want to, lots of questions for you myself, but I want to honor my audience and ask some of their questions. The first one I see is from Melvina McCabe, and she asks, despite legal challenges to some executive orders of the current administration, some judicial officials caved to the administration. Do each of your organizations have a contingency plan in the event our sovereignty and therefore our status are threatened? I would also pose this question to IHEART. Well, IHEART's not going to answer yet. We're going to save it for another time. Thank you for that important question. Malvina, we'll start with you, Danielle.
Yes, Melvina, we weigh things that go on in the administration and determine if this is something for us to get involved in and how. Judicial officials caving to the administration, I'm not sure if exactly what you're referring to, but I will note that on many of the judicial challenges that have been made to the executive orders, it has resulted in either a reversal or it has resulted in a preliminary injunction, something along those lines. So I'm not sure exactly about a judicial cave, but you know, the issue of your sovereignty is not one that we would take on as it's not there. I think that there are probably other groups that make the better case related to standing in that sense. And that would be a pretty big deal. I think that would be unifying, you know, among the organizations that are impacted.
And I'll say that that AAMC is partnering or continues to partner with AAIP, and I can imagine that they would be in a long list of people who would get behind our fight for that one. But Lacey, anything to add? And then we'll go to Moriah on that same question. Contingency planning.
Yeah, I think that we are all in that process of fight, right? Like this isn't something that isn't new for us as a population, in that we are always, our contingency plan is always the plan for fighting for sovereignty. So we are always in the middle of that battle.
Thank you, Moriah. Anything to add?
Yes, I'll just add that I want to agree with Lacey on that one. We are always in position, but as a general matter, AIHEC is not party to any legal actions at this time. We are closely monitoring the legal landscape, and there are a number of organizations that have filed lawsuits on behalf of tribal nations and individual tribal citizens. Our position is that tribal nations and tribal citizens we respect their right to be party to those legal actions. We are not a party to any of those legal actions at this time, but we are very closely monitoring that. And we work primarily in an advocacy space of educating and advocating. So there may be times in the future when we join lawsuits, but we are not a party to any of the lawsuits at this time.
Thank you, Moriah. You mentioned a collaboration between NIHB, I'm imagining NCAI, all of our leading organizers. Is there a way to, for us to find out more about the public messaging? Of course, we all agree and we'll be pushing forward the words that you've already, important words you've already stated, including the sovereignty message. But in general, where can we go? I've looked online and haven't found that collection of wisdom.
Wonderful. Well, what I'll do is I will, since I'm speaking from my phone right now, I will send that link to that website to you, and then you can disseminate it that way after this panel.
Fantastic.
Because the coalition group is doing amazing work, both with document production. I believe collectively we have produced these shared letters that have gone out to most federal agencies by now. And we've also sent follow-up notifications, and we're creating like one-pagers and advocacy materials. So as individuals or organizations that are considering joining us want to have consistent messaging about tribal sovereignty, you have this great body of work to work from. So
Fantastic.
I'll
Thank you.
send you that link so you can share it out to folks.
Okay. There's a question specifically for you, Lacey. You mentioned 4-to-1 replacement plan for the IHS. Can you please expand on that? What does that mean for our audience?
Yeah, in that executive order, it means that if you lose 4 people, you only can hire 1 back, right? So making that a bigger gap, that they made that restriction. So you can't go replace 1 for 1. You have to leave 4 and only have the ability to hire 1 back.
Thank you. Dr. Turnipseed, does AAMC have a benchmark or a plan for addressing these numbers, these American Indian Alaska Native numbers? I mean, I know you've been working with us in the past, but what's the new discussions given the horrendous decline?
First thing, I do want to dispel that Dr. Turnipseed. I am just Danielle. I am not a doctor. I am an attorney. So, Velveeta, do not confer that MD degree on me. Please do not. I'm gonna look to my colleagues, Norma and Kimberly, if they'd like to come on camera and to speak about our efforts in that regard.
Norma, you want to join this illustrious panel here?
Hi, can you repeat the question, please?
Yeah, how is the AAMC addressing those horrendous numbers that we just saw from not Dr. Danielle Turnipseed?
Yes, from attorney.
Yes, I know. I'm just teasing her. I'm just teasing her.
I know, I heard that part. Sorry, I just want to make sure I had the right question. So we have a range of initiatives, some of which Danielle shared in terms of really addressing the double digit, not only in the application, but the matriculation rates. And the first thing is that we want to have a better understanding of what might be happening on the ground. So I think that's where IHEART and other leaders are going to be super beneficial to informing us, because one thing is we were very surprised with the American Indian Alaska Native numbers compared to the other racial and ethnic groups, where the application numbers had decreased, where for other groups, the application numbers to medical school actually increased. So we want to understand what's going on in that pre-med space where we've seen declines. We have talked to some leaders of either centers of excellence or other centers historically that were supported by HCOP and COE funds, and learned from leaders that a big issue is that they're also seeing those declines in terms of participation in pathway programs. And so we want to be able to understand what is it that's happening broadly, even before they get to the point of applying to medical school. And also, we did expect that we would have some adjustments this year. We would see declines because we know historically when we had the kind of anti-affirmative action ballots in California and in Washington, that nationally we saw declines not only in medicine, but in law and in other areas as a result of institutions trying to readjust to respond to these numbers. So for us, there are multiple factors that are influencing this, not only the state laws, the policies, but the federal policies as well. But we want to understand at the community level what's happening, that we're not even getting the applicants. So that's a conversation that we want to have separately with leaders. So if anyone's interested in being part of that discussion, please just put your information. I know some of you already, but if you're interested in looking specifically at medicine, please do put your information in the chat. The other thing is that we didn't see the same declines for the schools of osteopathic medicine. They actually had increases in the number of overall URM. So part of it is understanding also with our ACOM partners, what does that mean? How do we understand this as a broader academic medicine community in building the next physician workforce? So there's more to learn. That's the short answer, I should say.
Thank you, Norma. That was really helpful. I had no idea about the decrease in numbers to our pathways programs, how alarming that is. So miigwech for that. Which also brings me to a question I had for you, Danielle. And you and I were both part of a meeting with the Deputy Chief of Staff with Department of Health and Human Services, and you talked about, thankfully, talked about the low number of HRSA grants, the Center of Excellence grants that there are out there. And I know many of our programs have applied, told we have incredible numbers, but there isn't enough funding. So I'm assuming that's just going to be worse. Thoughts?
HRSA is one of the areas that I am particularly concerned about for being vulnerable. While it isn't a huge part of the budget, it continues to be zeroed out for programs of interest, specifically around Title VII with the Centers of Excellence and Title VIII related to nursing programs. The thing about the HRSA programs that you're referring to, Mary, are that the exposure and the pathway for individuals to consider health professionals is so valuable. We understand that it's a long trajectory for someone to enter the medical, dental, nursing, pharmacy fields, but it is absolutely achievable. And sometimes you need a little bit of a exposure to understand and to get excited about a particular topic. And those programs have shown very good, very strong returns for what it is that they are intended to do. I think about 50% of the people that participate in those programs do matriculate into one of the health professions areas. And it's not to say that if you went in interested in a doctor program, you'll always be a doctor. Maybe you go into a different program, but we do see that kind of traction around health programs in general. And that's where, keep in mind, our emphasis, our interest in the healthcare workforce comes in. You know, we don't want to lose people. We recognize that there may be various roles for people to take on in that sector. So that is one of the things that's on our list, on my list, to ask about and advocate for.
Thank you, Danielle. If you ever need people to help you testify, I think you could find them at IHEART. We have had leaders through the years be able to show that when you look at the graphs showing our rates of acceptance or applications to medical school, that they're definitely affected by when we got those COE grants. So thank you for that work. All right, we have a couple of questions. Does anyone know if the decrease in applicants and matriculants for AIAN is also reflected in other health professions? And Dr. Ray Taylor from University of Minnesota mentions that she can speak to veterinary medicine. It's already minimal and it's decreasing even further. Does anybody know about the other programs? Any of you speakers here? Danielle, you said you worked with other program, or you were aware of.
I think Norma mentioned about the DO schools and seeing what the numbers look like. I don't know if you have other information to share, Norma. I would say if not, we certainly can look for and check in with some other schools and circle back to you. But Norma, I don't know if
Yeah, thank you, Danielle. For sure, we have our partners at the American Dental Education Association, because we work with them on a Robert Wood Johnson Foundation funded pathway program, the Summer Health Professions Education Program. And when I checked in with them, they said their numbers are looking good. So they didn't have any concerns at all. I mean, obviously the increases are small, but they didn't see a drop off. They didn't see a decrease.
Thank you, Norma. Kathy asked the question, are there any backup funds to help students, residents, and fellows when their funding is stopped or reduced? Has outreach or for funding been made to some of the sympathetic or larger orgs for wealthy individuals to help fill the gap if necessary? I don't know if any of you organizations work that closely with the students. So anything to comment on this by Moriah? Did you have something to add?
I'm not aware that we have individual resources at this time. AIHEC is a member-based organization composed of the 34 accredited tribal colleges and universities. So generally, we don't have individual resources. Our work is generally focused on supporting the tribal colleges and universities as institutions. But I certainly defer to others who have information about those resources.
Yeah, I think that might be more of a IHEART internal question. So I'm going to turn the next one over to Lacey. Dr. Adrienne Breguet asks, IHS suffers from high vacancy rates, especially 36% for physicians, and she wants to ask if the vacancy rate is for permanent positions that are not filled. However, when contractors are hired, they use the PCN numbers for the vacant permanent positions. Will IHS be allowed to continue to use these permanent PCNs to continue to hire contractors under a RIF plan?
So all of that is up in the air, right? So I think that they are required, all we know is that they are required by March 13th to do a RIF plan. What that looks like and how that is built, it's pretty unclear. So I don't really have answers, and most of this stuff that are going on in real time, we don't have answers. I think we can make a lot of assumptions. But I would say that Secretary Kennedy, silver lining, is in support of American Indian and Alaska Native sovereignty. And so he has stated that. So, and he understands the Indian Health Service and the American Indian Healthcare Act. So I think that there is a silver lining in that piece, but we don't have answers on what that would look like.
Thank you, Lacey. And I do see your hand up there, Chris. I'm trying to get through these in the closest to the order as possible, Christopher Derby. So there is one comment by Tanner. Thank you, Tanner. I think all of our speakers can see that comment in the chat regarding the push for emergency medicine to be 4 programs, 4 years, and how that could be harmful. So miigwech for that comment. And then I see Dr. Derby. Go ahead and ask your question, Dr. Derby.
Yes, thanks, Dr. Owen. I just wanted to follow up, I guess, with Danielle and Dr. Poe Hunter. You know, with the decrease in applicants and matriculants into medical schools, and there was a follow-up question: is it like in all of sort of the healthcare professions, do we partner with, like, say, allied health professional organizations or nursing organizations to necessarily know exactly what these numbers might be for our Native Americans?
Sure. Chris, we have involvement and actually AAMC leads a coalition called HIPNIC, Health Professions and Nursing Education Coalition. And it's about 90 organizations, health professions, and it includes pharmacy, nursing, the full scope. So these are the kinds of questions and kinds of conversations that we can have. Certainly the group is very often focused on advocacy related to programs, but this lends to the conversation as well. So that's something I can take back to my colleague who heads up our work with HIPNIC and look to share with this group.
Thank you.
And let me just say, your question is such a great one. Successes, they seldom come alone. So it is so important for us to do work and have true coalitions. And what does that mean? That means when I'm in the room speaking about an issue and I have a captive audience, I'm not just speaking for my one role in something. I'm not just going through a narrow checklist, but when you need support for the system versus cutting one area to raise another area up, that's not what I'm about, you know? And if it means dedicating more resources to taking a systems approach, or if we're looking at borrowing from this administration's words, you know, I'm struck that a lot of things feels like everything is under fraud, waste, and abuse. Well, let's not sweep up everything just under those terms. If that's what you're really going after, then identify it on the front end and have plans. I think as somebody was, as Moriah was saying, you know, looking at the reductions in people, where's the plan? How do you plan on addressing the needs in this community? Can we agree on the prioritization of addressing what's going on and then figure out how to get there versus taking an axe or slashing to achieve a financial number and then trying to pick up the pieces thereafter. So coalitions are so important, and I'm glad you asked about it.
Thanks, Danielle. And that's what IHEART is all about. So we completely believe in that work. Go ahead,
Mary,
Norma.
if I could add also to respond to Christopher's question, each year we have this press release, you know, on our enrollment matriculation and just kind of what the current incoming class looks like. And we monitor not only across the health profession, so we do work with partners. There's several groups that focus on it's an interesting acronym, FASHIP, the Federation of Associations of Schools of the Health Professions. And so leaders of each of those health professions organizations come together to talk about cross-cutting issues in healthcare and in the health workforce. Also, as a result, we also look at higher education trends because we have an understanding that if we see something early on, what can be happening, right, at the college level to understand why we're not seeing the numbers that we anticipate seeing. So we do kind of take broad strokes to understand what that overall higher education continuum looks like.
Thank you, Norma. Hopefully that helps, Christopher. Before Gail, I see your hand up and I'll go to you, but I do want to ask Lacey one question that directly involves IHEART as well. And that is, you mentioned in one of your slides, you had a nice slide there about supporting Pathways program. Can you tell us more about how NIHB does that? Yeah, how do you do that work? And is there potential for a stronger partnership with IHEART, given our support of all the pathways?
Ooh, I'm excited you asked that question. Yeah, so obviously on the policy side, right, we're pushing for paraprofessional work, peer specialists, you know, behavioral health, dental aides, all of those things. What we really want to do in our new initiative is really supporting from certificate programs, tribal colleges, all the way to universities, and really getting together a good partnership in supporting our youth to be able to start from the reservation communities to go all the way to their universities, whether that's a certificate to a 2+2 program with the tribal colleges, to universities, then to medical school. And so it's in the very infancy stage, but anybody that is on board for that, we are all about it. So we are trying to do some fellowships here at NIHB, getting more youth involved, right? We say youth as in 18 to 25. So if anybody has out of the box thinking, want to participate in that, we are energetic about that, and we want to do more programming towards that. And we want to do more programming towards that outside of the federal government grants, right? So we're really pushing, we were doing this before, but I think we've accelerated that, pushing towards finding more philanthropy and private funding to do that. So the more partnerships, the better. I think this is a great time to realize that we need to do this together, that there is no competition anywhere. This is really to get more American Indians providing services that look like each other, that understand each other and understand their community. So, and yes, anything and everything in that you want to partner with, we would love to.
Lacey, can you tell me again the name that you're giving that?
Right now we don't have a specific name.
Okay.
We just have, it's a little bit of bits and pieces to it currently, because like I said, it's the infancy stage as we're getting getting that pieces together. But we do have a fellowships program starting for the public health and environmental health, and then we're trying to get more direct service care within that fellowship program.
Okay, so when we reach out to you, we can just mention the pathways and you'll know what we're talking about.
Yes.
Pathways that you mentioned on this webinar or this.
Yes.
Okay, excellent. Thanks. All right, Gail, do you want to come on and ask your question?
Yes. Good afternoon, everyone. Thank you for all of your comments and your presentation as well. And this is more just a comment than anything. I think those decreased numbers of 15% is just horrendous. I knew it had gone down. I didn't realize it was that much. But I am just wondering how much the pandemic impacted our students, especially those students who come from the reservations, which were called home, whether disrupted in their pathway to medicine or other health professions. And as we look into some of the causes, perhaps an impact of the pandemic, on our students, just because it was such a huge impact on our Native people. You know, we suffered a big burden of COVID-19 and all of the everything around that. So again, just a comment. Thank you.
Thanks, Gail.
Yeah, no doubt that that's certainly a way to look at it, and the need for the mentorship, the need for the connection. There are other groups that didn't experience a similar decrease, but regardless of how we got here, we've got to dig ourselves out, right? So that means connecting ever more and really leveraging the programs that you know to be successful. Lifting up the people who are physicians and other health professionals to remind those future students, one, that it is a profession that is rewarding for that individual, and two, that the future physicians, the future health professionals can do it. Okay, I'm not here to substitute the diversity that exists on the chart that we showed with achievement and with merit. So despite a lot of what is being said, they absolutely can participate and apply and attend medical school and become those fantastic physicians, but they need to be told that, and we need to read that and pour that into them each chance that we get.
Thank you. Maya?
Yes, I totally agree with everything that everyone is saying, and it's really alarming to see those numbers decrease, and that's why we're all here to enhance our native backgrounds into medicine. I do youth medical education within Butte County. It's in Northern California, and so really enhancing our students to learn more about healthcare careers, and we're slowly starting to get into tribal reservations to really empower them that they can get into healthcare. So just being here is just really impactful for me to learn from every one of your guys' perspectives. But also, I would love to get Lacey your email. I thought what you were talking about was just so interesting, and I would love to learn more on your side of what you do. So if that is possible, thank you.
Thank you, Maya. And she put that in the chat already. All right, Kathy, do you have a question for one of our presenters? Not all three?
Maybe for one comment and then maybe a question or two to address. So I'm in a variety of different areas. I do stuff for NASA and things like that too. And so that's a good resource to look at for example, I was invited to Alliance of 45 states for science, tech, engineering, math. They're big coalitions, and I've chaired a coalition for science, math, and engineering education. And so those kinds of programs I have set up where you're looking at starting at pre-K through actually graduate school. And we could talk, I'd love to work with you because I've done it for the broader thing. For example, NASA wanted space technology curriculum. So I coordinated with the Space Consortium and the university and the tribal colleges down through. So I would love to talk with you because they do have some processes that seem to work where you like have put in place internships and then direct credit going into the from the tribal college to the state university, so they automatically get credit for some of those courses. So but anyway, I just want to throw that out. The other thing that I wondered about was, would it be possible, or would any of the organizations be interested in a training program for some of the healthcare providers that are going out into the Indian Health Service to train them a little bit on how do you do outreach? It's not necessarily natural for every healthcare provider to maybe even have that warm, fuzzy side to go out and reach out to the students. But they could, would any of the organizations help produce something like that where you could have some minor training? Like when I lived on the reservation, I started Health Careers Club and all my kids went to college, you know, but I've also had a 21-month-old in a space camp. Not everyone has this kind of personality type, but would anyone be interested? And do you have anything like that where you would consider training the providers that are going into community to understand how to do outreach? It's not necessarily innate. That's all. Thanks.
Anybody have anything, want to respond to that one?
We
Go
don't
ahead.
have anything, but we definitely advocate and have trainings for cultural safety, which is very, I think, the first step before outreach. So those pieces are in place, but there isn't anything specific to how to do outreach.
Thank you, Lacey. And I think that that's actually part of IHEART. Many of us within IHEART are doing some of that outreach work. And so maybe this is more of a conversation between all of us right now. I want to ask all three of you if any of you are aware of, it looks like it says 2 participants have raised their hand. I'm not seeing those hands. So in the meantime, if Izzy, you can help me if I'm not missing some hands up. But
Yes, I think that Chris has his hand raised.
Chris, is that new hand or old hand?
No, new hand.
All right, let me ask this question though, okay?
Okay, sorry, I'm plaguing you.
It's okay, we have time. The tribal nations have not always had great relationships with states per se, because we don't want them to supersede our relationship with the federal government. But still, are you aware, particularly you, Lacey and Moriah, of any more better relationships developing because of what's happening at the federal level? Is anything going on there that we should know about that might be helpful? Moriah, I see you nodding your head, so I'm gonna turn to you first.
Certainly. Thank you so very much. I will just say that, we've actually been looking into this issue very closely, and we're in the middle of conducting research on the level of support that individual states provide. Sorry, my phone is blowing up with, hang on, let me make sure. Okay, there we go. The level of support that individual states provide to other colleges and universities, from community colleges to land-grant universities, all across the board, and to create a playbook on how to advocate for parity, to make sure that tribal colleges and universities are receiving the same support as other colleges and universities in the state, both as a matter of just simple parity and fairness, because tribal colleges and universities are open to everyone, regardless of tribal citizenship, and they serve entire communities and are drivers of economic growth for entire regions. We want to make sure that tribal colleges and universities receive the same type and equivalent amount of support as other institutions in that state. So we're doing a state-by-state review of those different levels of support and types of support that different states offer. And then we're going to be looking at how we can make the case that tribal colleges and universities should have that same access because of the great work that they're doing. And it doesn't change the fact that there is a nation-to-nation relationship between tribal nations and the federal government, and that tribal colleges and universities are chartered by tribal nations as an expression of sovereignty. It simply means we're looking to make sure that, in addition to what the federal government is obligated to be providing, and that we hold the federal government accountable to do that, that we're weaving in strong systems of support in that state as well.
Thank you, Moriah. Lacey, anything to add to that? Any relationship building with states that you're aware of?
Well, like I said, was the 1115 waiver, right? That's forcing tribes and states to work together on how to utilize and build Medicaid. So I think that'll be really interesting on what that looks like. I would say in the overall landscape, it's getting better than it was early in my career, right? So I won't tell you how old I am, but in the last 10 to 20 years, there has definitely been a better relationship. We also are doing some connections with electric case reporting and really doing Board of Health and trying to incorporate what that would look like.
Thanks, Lacey. Chris, go ahead and ask your question.
Oh, sure. Yes. You know, I think the reshaping the journey that came out in 2018 from AAMC and AAIP is a wonderful document of blueprints, so to speak. But in the setting of sort of this, you know, dismal reporting of recent numbers, is there any perhaps incentive to revise this or maybe reinvent what we're thinking, and maybe there's a different pathway forward?
I want to say before you jump in, Danielle, that we are talking about that in IHEART. Actually, Norma's not here right now, but we've been talking about that for a while through another organization, IHEAL. Go ahead, Danielle.
I would also offer, Chris, that I think it is important for us to consider, but realize that things that are specifically targeted will also come under scrutiny and possible attack, right? So, you know, I think we've got to figure out the ways to get the message across and how we communicate it out and publicize it in a way that is consistent with the law and doesn't overexpose organizations or I'd rather say get misinterpreted, right? So this isn't to the exclusion of anyone. This is to increase the applications among, you know, the population. So figuring out how to do it and what the updates need to be is certainly something that we will take under. We receive your suggestion.
Thank you, Chris. Moriah, to that, you know, that reminds me of a question or a comment that you made, that it felt like once President Trump turned over control of those departments back to the secretaries, that we might have had better outcomes. Can you tell me, are most of the secretaries understand? Were you saying that most of the secretaries understand sovereignty and the implications? What was your, go ahead.
I would say that some of them do.
Okay.
And that part of what the coalition group is doing is working to educate every single secretary. And I did put a link to the coalitiongroup.net in the chat. And that includes links to all of the letters. You can go and actually see letters that this group that we're a part of has sent to the Department of Labor, the Department of Justice, the U.S. Doge Service, HUD, Treasury, Small Business Administration, Department of Defense, Health and Human Services, Office of Management and Budget, Department of Interior, EPA, Department of Ed, and Department of Homeland Security, and then also kind of an open letter to the White House and Congress. So we are aiming to touch every single agency and make sure that every single secretary understands the trust and treaty obligations and the nation-to-nation relationship with tribal nations, and understands what those obligations entail, and also that there are opportunities to work together. You know, as this administration's position is that they want to create more efficiency and make, you know, there are certainly some processes and procedures at federal agencies that can involve burdensome paperwork, that maybe those can be reevaluated. We're not just in damage control. We're also trying to say, look, there are opportunities where we can partner together. We would like to make the federal government more efficient as well. You know, there's really opportunity here rather than just being constantly on defense. And we want to make the case that there are winnable opportunities to better serve tribal nations throughout this restructuring of the federal government.
Thank you,
And
Moriah.
need to be partners, clear partners in this endeavor.
Thank you, Moriah. I want to go back to, I think it was you, Lacey, that mentioned Medicaid. It was either you or Danielle, but that's one of our, as healthcare providers, one of, I know, my biggest concerns, and I was just talking with pediatrician, Dr. Jason, on here yesterday as well about that concern and how that's going to affect our kids. So are you following that at the AAMC, NIHB? I imagine you are. And, where's the fight? Where can we jump in if necessary? All of that. And Lacey, I saw you nod your head, so I'll turn to you first and then you, Danielle, please.
Yeah, I think that just goes to really that advocacy of individually calling your Congress, calling your senators. I think that is looking like it, like there's a smoke screen there that's happening. And so I think that advocating and teaching everybody else how to individually advocate, I think that is kind of the best strategy going forward right now. So yeah, I think that we just need to get on our phones.
Does an NIHB have a effort though on this, or a particular, or is it just pushing everybody to do individual activism?
Oh no, yeah, we are so we're testifying. We are Senator Moore. She's pushing it through the Women's Caucus, Democratic Caucus, and so there's a lot of pockets that we're definitely testifying and pushing for and advocating for.
Okay, thank you. Danielle?
I'd just like to add on to what Lacey said. You don't just need to advocate when there's a problem. You need to advocate and say, thank you for the support that you've given. Here are some new results that we've seen. This is the progress. This statistic is going down. And if someone only knows you when you're looking for money, you're looking for funding, or you've got a problem with them, they probably in their mind see you coming, and who wants to walk into that all of the time. And I would encourage us to think about not just the obligation and the sovereign, but the way that this is important for the community. This is important for the economy. It's important that these programs exist so that people can be taken care of and live better and more productive lives. I mean, there are different ways to spin it, but when you're talking about the advocacy, there are a number of ways for us to get our AAMC advocacy materials to people who are in our network. And certainly I'll touch base with Kimberly and see what our options might be in order to, either make not just the materials, but the training opportunities available to more.
Thank you for that. We do have another question. I'm going to ask Abigail to come online because it's a bit of a long question there. And Abigail, are you there? Can we have you ask that question?
Yeah, I am here. Thank you. Yeah, so my question has to do, so I'm in southern Southeast Alaska, and there's, a dearth of leadership and big challenges with the healthcare system here. And there's a coalition of tribes that is kind of on the ground level working on a plan to implement a pathways program. We're looking at the HRSA RCOR Pathways Grant, not knowing kind of the future of that, but looking more globally at how we are working to improve the healthcare system. And particularly, there's an emphasis being placed on peer support, behavioral health aids, and crisis prevention. So my question really is sort of a perspectives, if we're having issues with getting people into the workforce or seeking those, I'm curious if there might be an opportunity for research around how we are working with the individuals, because I see issues with the education system, I see issues with the healthcare system, and all of that. So I'm currently working on a doctorate in interdisciplinary leadership. So just curious about perspectives on how I might be able to leverage that to understand what's going on here locally and how we could best address it.
Moriah, you go ahead.
Great. Well, first of all, I just wanted to note, so I also just put AIHEC's legislative priorities into the chat. That's a link to our website. It talks about our appropriations priorities for individual appropriations bills, but it also, this is the really exciting part, is it includes impact sheets organized by states for the different tribal colleges and universities, and talks about the great work that each TCU is doing with regard to workforce development and and economic development and the positive impacts that each TCU makes in their communities. We really highlighted that as part of our legislative summit this recent February, and I think it's just such an important story to tell, the tremendous efforts from all the way of kind of point of entry point programs is what I call them, certificate programs, to associates to full nursing degrees, and also the important partnerships that TCUs have with health systems and with other aspects of their community. One piece that we really want to work with NIHB more closely on is how can we work with the Indian Health Service to make sure that there is a smooth pathway from certificate, associate, and bachelor programs directly into positions at the Indian Health Service or into tribal or urban health facilities, because we have amazing Native students who are doing great work, who are getting these degrees and want to stay in their communities and serve their communities and also get some experience and then maybe even go back to school or continue on working in their communities. And we're sometimes seeing with IHS kind of a mismatch in how they advertise entry-level opportunities. So it's really making sure that IHS knows they have this incredible talent pipeline coming, but right now there seems to be a little bit of a mismatch with them being ready to receive these amazing students. So it's working to harmonize that, and it's working just to kind of say, like, look, don't leave this amazing resource behind. IHS is famously, as was noted earlier, operating from a position of being understaffed. And TCUs and other colleges and universities offering medical degrees and other health profession degrees are willing, ready, and able to provide graduates into those positions. So it's making those two pieces fit.
Moriah, thank you for those comments, and thank you for that work with IHS. That's been a bone of contention with many members of AIP for many years, and we even recognizing how understaffed they are, we know that there's just so much more that could be done in that area. We glitch for that. Lacey, anything to add there? And I love that idea of IHS working or NIHB working with the tribal colleges. Go ahead, Lacey.
Yeah, so I think that I can't speak specifically to research, but I do know that there is pieces everywhere, right? So kind of before the administration came, HRSA and SAMHSA have a lot of, there was this big technical assistant for paraprofessionals, I think that's, and then there was a BWET, right? Like I think as a coalition, as IHEART, and thinking through outside the box, there's these pieces that are happening, there's these grant opportunities, and I think we as the big picture need to start lining those up, right? So if there's funding out for the BWET to do paraprofessionals, having tribal colleges do that, and then the BWET for the universities, those two combining, I think that making those connections and stringing those beads together is really what we need to do as coalitions, as partners, because there's pieces out there, but they're not connecting, if that makes sense.
Thanks, Lacey, and you're singing our tune. That's all what we're all about here, is making these connections and breaking down these silos between all of our, not only the health professions, but the different schools, the tribal schools, all of that. So miigwech for that. We are getting close to the end now. I want to leave time for each of you to leave us with your parting thoughts or your last words that you really want IHEART to hold on to as you know, as we move through these next few years and continue to address the disparity, some even worse than before. So Miigwech, we'll start with you, Danielle. Top of my
Great.
screen.
Great, thank you. And I really appreciate the conversation and being able to be here. This is not a conversation or a table that I'm participating in very often, but given my past work, I worked for a senator from Arizona, always really docked into the issues when I worked then. So the opportunity to work on this, participate again today is meaningful. I would offer that time moves on, but progress is not linear. And unfortunately, as you saw from the slides, sometimes there are setbacks. Sometimes the slope is not up, or the rate of progress is not as consistent. And I have to find myself digging for the resolve and figuring out a way forward when I realize that it feels like some things are rolling back in terms of progress. But what we can't do is abandon the purpose. When we meet obstacles, we can't retreat from the fact that what we're seeking to do is impactful and valuable. And I think that's also a time when we have to lean on community stronger than we have in the past. So let's use the tools, let's use the data. I think data and evidence are really compelling because this is not just a matter of wanting to do the right thing, but we see by the numbers what the impact is, and the numbers don't lie. So I encourage us to take a moment and process what's going on and look for ways to redouble our efforts and to deliver on what it is that we seek to do.
Thank you. Moriah?
Thank you. I just so appreciated the opportunity to participate in this panel and to hear about the amazing work that everyone's doing. I also really love puns, so I'm going to say to everyone, take heart, be strong. You're not in this alone. We are in this together. We are here to help each other. And the work we are all doing is so important. We each have pieces to help put together to get us where we're going. And we really are stronger together. So take heart, be of good faith and good cheer. We are working together and we can achieve a lot together. Thank you.
Thank you, Moriah. Lacey?
Well, thank you so much for inviting me in this space. We haven't been in this space in a long time. And so I just want to leave everybody, just kind of echo Moriah that we are more powerful together. And we've really learned, especially in this first 100 days of this administration, right? This is really about, we can't sit back. We really have to be proactive together. We have to think outside the box together, and really, you know, be like water, right? Like we need to be clever and go around those boulders, go over those boulders, whatever we need to do. We really need to be a collective body of water to keep moving forward. So thank you.
Well, those great words to end with. I'll turn this back over to Izzy. Thank you so much to all of our panelists. This has been very helpful.